Welcome to painACT, a Train the Trainer program that is free to use for Australian residential aged care. This video is for nurses who are considering being a painACT trainer at their work. In this video, you'll learn more about the painACT program, how it works, how it's structured, as well as pragmatic advice on how to roll it out at your facility. painACT stands for Pain Aged Care Training, and this word was chosen as it also suggests the need for action, to be proactive with pain management. painACT is a training program designed for nurses to empower them with the expertise and education material they need to upskill their staff on pain management. So painACT is a self-taught program that trains nurses to run pre-made education modules. These education modules are for all staff, but particularly non-clinical staff like lifestyle services and personal care workers, so they can be exposed to pain concepts and to get them thinking more about pain at work, to be more vigilant about pain, and to act accordingly in response. A Train the Trainer program is designed to train staff with the skills and knowledge needed to teach others on a particular topic. So instead of relying on external trainers, a Train the Trainer program focuses on building internal capacity at your work so that training can be conducted in-house. painACT is such a program. This program shows a nurse at your facility how to run a simple pain education program with teaching material that has already been developed, and how being mindful of how busy aged care staff can be, painACT has been developed so that a nurse can pick it up and train staff quickly in bite-sized pieces with just a little preparation from the trainer beforehand. A nurse educator is the ideal staff member to be the trainer. They have the skills and experience in teaching that helps them create an environment for learning. If you don't have a nurse educator available, consider also a nurse practitioner or a senior nurse. Typically, they have considerable experience in aged care and some exposure to training others informally. Though a nurse with expertise in pain management skills is preferable, at a minimum, a nurse with some interest in pain can be a suitable painACT trainer. Training is delivered in short 10-minute sessions, often with a small number of staff and in an informal setting. Most training sessions have a video for staff to watch, followed by some discussion. For these reasons, running a session should not be too intimidating, even for a nurse without too much teaching experience. Also, you may want to consider having more than one painACT trainer at your work. These staff members can then share the task of training. This approach is better to ensure that all the staff have the opportunity to see the education modules, especially night staff and weekend staff. painACT is composed of a number of education modules designed to introduce all aged care staff to pain concept, to think more about pain, to be mindful of pain, to act on pain, as well as more general skills such as empathy and communication. There are two main elements to the painACT program. One, to provide the trainer with a training program that is simple to use and easy to teach. And two, to provide additional resources so that the trainer can prepare and feel confident to train their staff. painACT is suitable for all staff working in residential aged care, whether they are nurses, personal care workers, or assistants in allied health, or lifestyle services, or environmental staff. However, we think that personal care workers and lifestyle services will particularly benefit from this training, and so the information in this program has been tailored with them in mind. The advantages of this Train the Trainer program is that it is free to use and in-house. painACT is also delivered as a series of short education sessions, so you don't have the logistical problems of coordinating a large number of staff for a half or a whole day of training. painACT can be delivered in small groups more frequently and during quieter times at work. painACT has 8 education modules. One education module is for the trainer, which this video is part of. 6 education modules are for training for all staff on different aspects of pain management. And 1 education module is specifically for nurses. It is recommended to first run the education module on an introduction to pain in aged care, but other than that, there is no particular order when running the modules. So you can select your own order based on the local needs of your aged care facility. The education modules aim to help staff improve their understanding about pain awareness, communication and treatment so they can apply this to actual practice with residents. The focus is on providing examples of how to approach these situations and giving staff opportunities to reflect upon the daily realities and residents' experience of pain rather than just providing theoretical knowledge. So most education modules have a video followed by a discussion on how to apply it to everyday practice. This teaching approach is to show, not tell, as this is more likely to engage staff. This program was designed with the view that it's more important for staff to see examples of person-centred care than it is to learn labels like person-centred care by rote. Each education module focuses on one topic related to pain management in aged care. How to use the painACT trainer program, which is just for the trainer. Introduction to pain in aged care, impact of pain on the person, family and staff, conversations about pain, pain assessment which is targeted for nurses, pain and non-pharmacological management, pain with dementia, and finally, documentation. The education modules are a mixture of video content followed by discussion. The purpose of these modules is to generate reflective discussion. The learning material is much more effective when linked back to staff's actual experience and real residents in your facility, rather than too much focus on a hypothetical case study. Each education module has an aim, a few key messages, a video, some sample questions or prompts to promote discussion, and handouts for staff. The key messages and discussion points are meant to help guide your discussion and encourage staff to reflect on their practice. Make sure you read all of the material first so that you can be confident in your delivery in this training program. It would be ideal for you to be across any current issues with pain in your facilities. This could include discussing pain management with other staff, conducting a pain audit, reviewing pain charting and assessments, reviewing the use of analgesics, documentation of PRN medication, and any recent complaints regarding pain management from residents or family, reviewing serious incident response scheme reports, and being with familiar individual residents with complex pain management needs. Each module is designed to take about 10 minutes to teach before running a module. Read the material that accompanies the module, watch the video, and reflect upon the discussion points. Think about the key messages and how they can be applied to day-to-day practice at your facility. Most of these modules in this training program are staff being trained to reflect upon pain management at the facility. It's important that you make the painACT training relevant to their daily tasks and challenges encountered in their work. For each training module, aim to make the presentation interactive and practical. Incorporate real-life scenarios and case studies to make the learning experience more engaging and applicable to the particularities of your facility. How the training is delivered can be flexible around your facility's schedule and needs. Here are some suggestions, but we encourage you to modify how you run painACT based on what suits your facility best. The key consideration is ensuring that training is delivered so that all staff across all shifts are trained, whether they work mornings, afternoons, night or weekends. The same education module could be run multiple times in 1 week to ensure that all staff across all shifts, as well as part-time staff, are included in this training. This would mean dedicating 1 week for each education module. The education module should also be delivered on a regular basis to account for staff turnover. For example, once yearly, or when there has been a significant change in staff turnover or onboarding an influx of new staff. Ideally, the modules would be delivered during quiet time on the floor. Here are a few suggestions on how to run the painACT program. Option 1 is to choose any 4 education modules and deliver 1 module each week for a month. If you want to keep doing the rest of the modules, you can continue to do so. Timing the training sessions with International Pain Awareness Month, which is in September every year, could complement this timing. Another option could be to run 2 education sessions per week. Though be mindful that staff need time to reflect and incorporate learning between each module. Please note that the education modules have not been designed to be run all on the same day like in a half-day training session. Though your resourcing might necessitate this approach, it's not recommended. Successfully incorporating a new training program into nursing homes requires a thoughtful and strategic approach. Here are some key steps and considerations. Do have enough buy-in from senior management for this. You may need to conduct an assessment of the current skill levels, training needs and challenges faced by your staff. Identify areas for improvement and prioritise the training topics that align with the facility's goals and residents' needs. This information may help convince management of the need for more pain training. Do you as a trainer have some protected time to prepare and review the material? It's important to discuss with management that there is some preparation work involved to be ready to run the painACT program. Do you feel capable of being a trainer? Being a trainer can sound intimidating, but remember that you are mainly showing videos and leading the discussions in the education modules. And these sessions are short and will likely be in small groups of people you work with. You also do not need to have all the answers, but building up your knowledge will help you feel more capable. So if you're not confident in the background material, refer to the second edition of the Pain Management Guide Toolkit for Aged Care and the second edition of the Pain in Residential Aged Care Facilities Management Strategies. NARI, which is the National Ageing Research Institute, in partnership with the Australian Pain Society, developed the painACT Train the Trainer program. The content of this program was developed in collaboration and co-designed with aged care staff. painACT was funded by the Department of Health and Aged Care as a part of a larger grant for educating health professionals to improve pain management.